In regards to tests and vaccines, 68,509 tests were processed yesterday. There were 36,383 vaccines distributed through state-run clinics, many more than that distributed through primary care, and well over 90,000 vaccines distributed again in Victoria as Victorians come forward in increasing numbers to be vaccinated. We are now at 86.7% of the 16 years and over population who have had their first dose of COVID-19, and we are sitting at yesterday 59.8% of the Victorian community had had their second dose, so of 16 and over. So clearly we will pass into the 60% of the double-dosed Victorian community today. We do have a few announcements to make about the support of our healthcare workforce and the supplementation of that workforce that we did want to make this morning. We know that the next few months, as Victoria opens, are going to be incredibly challenging and difficult for our nurses, our midwives, our doctors, our paramedics, and in fact all of our healthcare workforce. We will see demand and challenges that our healthcare workforce has never seen before. As Victorians get back to the things they really want to do in a safe way, we will also be placing immense pressure on our healthcare workforce as they continue to care for a record number of patients in our hospitals and in our ambulance services. These Victorian frontline healthcare workers are the backbone of our COVID response, and we need to support them and recognise the support in every possible way as we help them to deliver the very best possible care when Victorians need it most. That's why today we'll be announcing a couple of things. Firstly, we're investing some $2.5 million to recruit up to 1,000 healthcare workers who are currently living overseas as part of a package designed to help to ease the pressure on our hard-working, hospital-facing staff dealing with COVID. This group will largely be made up of returning Australians who have wanted to come back in our healthcare workforce, but equally a large number of international recruits. These professional groups will cover nurses, doctors, midwives, and a range of allied healthcare professionals, and they will be recruited on the basis of the services and support that our hospital system needs. To be eligible for this program, eligible healthcare workers need to have an existing employment contract with a Victorian healthcare service and have the active professional registration in place and to be ready to travel. This announcement builds on the work that we have done in recent weeks, having facilitated the arrival of some 130 healthcare workers under the dedicated healthcare work pathways system that we've had in place since August, and this is the next logical step in making sure that we turn back on that international pipeline of support for our hospital system that has been on hold for the past 21 months.